What's going on, guys? This is Dr. O. Hope you had an awesome day. It was a great, beautiful day. As you can tell, the sun is shining in Springfield, Missouri. Man, I love the sun. I don't know about you guys, but we've had some rough weather. It's not been seasonably warm. It's been unseasonably, I don't know what the word is, seasonably cold, something like that. Unseasonably cold. That's what I'm going for. So today in the Dental Drive, this is episode 3. So we're just trucking along. This is 3 days in a row. Anybody liking it? I don't know. I don't know. I'm enjoying it. It's a little bit of fun. So we're going to talk about something that I think is pretty cool. It's the like main person you want to be in good relationship with at your dental practice, and that is your hygienist. They change the world, right? So all you hygienists that watch this, big thumbs up to you. Matter of fact, if you have a channel, let me know. I'll thumb up your hygiene channel. But hygienists are rock stars. They make a huge difference for the health of our patient's mouth. Probably more so than dentists, really. I mean, we come in and we reconstruct and maybe fix things, but hygienists prevent so much. So why is it so important and mandatory for you to visit your hygienist? And that's kind of the topic of this video. So we all want to brush and floss, and hopefully you're doing that a couple times a day. And at least for a few minutes, making sure you keep your teeth clean. But even if you do this and you're a rock star at it, it's still not going to prevent something that's going to build up in your teeth, and that's called tartar. Tartar's like that calcified plaque. It's hardened onto your teeth. You can't get it off with a toothbrush, and so there comes in the need for you to go to a hygienist. Now you might be going, man, I haven't been in a while, I have any problems. The reason I decided to talk about this today is we had a patient today, no pain. The only reason she came in is her gums are starting to bleed. She's a previous smoker, so she quit smoking. Hats off to her. That's awesome. I know that's not easy to quit smoking, but the smoking was preventing her gums from bleeding. And if your gums don't bleed, you wouldn't know that they're infected. And that's what kind of smoking kind of masks that. But her gums were severely infected from the tartar buildup. And even worse, she was suffering from periodontal disease and didn't even know it. And this is kind of the big deal. Periodontal disease causes so many things. That's a whole other discussion, probably, at least 10-15 minutes of kind of laying out the groundwork of why periodontal disease can be so damaging. But long story short, it causes bone loss and can do it silently. You'll have no clue it's even going on. And before you know it, half your bone is missing around your teeth. And that's what the story was for this lady. Beautiful teeth. Fortunately, not a ton of decay, but half of the bone is gone on our teeth. So now we got to do what? We got to have those hygienists who are, by the way, they're expertly trained. They go to 2 years of extra training just to learn how to clean teeth. You can imagine how good they are if that's what they focus on, is cleaning teeth for 2 years. So, that's why you got to trust them, take their advice. They're going to be able to really guide you on the right path to really maintaining your teeth and keeping you from spending a lot of wasted money on your oral health. So that's important to kind of listen to them. Think of them as like your first defense to prevent you from having to see and get shots from a dentist like myself, who has to maybe come in and fix things that are gone a little too far. But anyway, so this patient had this problem, and we were able to let her know that, hey, we got to get you healthy and clean that up. So what does that look like? So let's say you've lost quite a bit of bone from periodontal disease, or you've been suffering from it. We can't really just reverse and grow the bone back, but we can at least halt it. And so what we want to do is do what's called a scaling and root planing. It's a specialized type of cleaning that's just a deep clean. It goes below the gum line and specially removes all the tartar around your teeth. And because it's so kind of skilled, it takes quite a bit of time, and there's obviously a lot of tooth structure to go around and clean this all off. And so it takes at least maybe about an hour and a half to 2 hours per half of the mouth if you have that type of disease. Now, you may have tartar buildup and aren't susceptible to periodontal disease, don't have the bone loss that comes from the tartar buildup, and that's why just going every 6 months to at least once a year to make sure that your hygienist can help knock off that tartar. So that's why they're awesome. That's why I titled this "Hug Your Hygienist," because they're awesome. They're really valuable. Make sure you appreciate them. They work really hard doing kind of that's a tedious task to go around each tooth and kind of remove that tartar. So also I want you to know that there's a lot of people who have asked about Maybe, they have some condition or some issues that they'd like to be addressed and fixed, and they might want to travel, or maybe they don't have any financial way to do it. We've got something pretty cool coming up that you'll be able to submit some information. We might be doing, some sort of giveaway. I don't want to spill the beans on all the details, but it's going to be awesome. It's going to be really cool. It may cost you next to nothing, or actually nothing. So I get so excited. I want to fill you all in, but you're gonna just have to wait and be patient. I'm not very patient. I don't know if you guys struggle with patience. I definitely do. And then I'm gonna give you a little prelude to tomorrow. So tomorrow we're gonna have a good discussion on. I keep getting asked, what in the world are you doing giving cookies and cappuccinos and sugar at a dental office? It's a valid question. I've got a really good answer for it. I'll talk about it tomorrow. But if you enjoyed this video, learned a little bit about tartar buildup, learned about loving your hygienist, giving them a hug, high five. My hygienist, when I told him I was going to do this, they're like, don't tell everybody to give us a hug. I'm like, okay, well, it's a play on words, right? Hug your hygienist. All right, but I hope you guys enjoyed it. You guys have an awesome evening, awesome day tomorrow. Thanks for watching, and give the video a thumbs up. Subscribe if you haven't already. I hate saying all that stuff, but you got to say it, otherwise you forget, right? So if you've watched to now, please give me that, courtesy. Do that little thing like that. And you guys have an awesome one. Keep smiling.